And the recording has begun. Good morning, everyone. We're going to give it another minute or so, and then we're going to get started. Okay, I want to be respectful of everyone's time, so we'll go ahead and get started. My name is Sophia Simmons. I am the Communications Director for Family Values at Work, and I welcome all of you to our press event this morning. Thank you for taking the time to join us. We will be discussing a new report out of the University of Wisconsin, and we have a couple of guests lined up to speak with you this morning. Um, I will ask that if you have questions throughout this event, that you put your question in the chat box with your name and affiliation, and I will go through the questions and make sure that we can get back to them in a timely fashion once all of the speakers have spoken. With that, I'm going to pass it over to our first speaker, Shaniva Smith from 9 to 5 Wisconsin.
Hi, everybody. Good afternoon. Thank you so much, Sophia, for the introduction. I'm Shaniva Smith. I'm the senior organizer for Wisconsin 9 to 5 chapter. So I want to thank you all for joining us today to discuss the findings of this important new report and to learn why their recommendations are so urgent and what Wisconsinites can do. We'll have 4 speakers today. First, you'll hear from Dr. Jonathan Heller, who is the Senior Health Equity Fellow and co-author of the Report on Healthy Workers, Thriving Wisconsin by the University of Wisconsin, Population Health Institute Healthy Workers Work Group. Then I'll speak briefly about the history of the fight for paid sick days in Milwaukee. Belinda Thielen, an industrial hygienist with Voices de la Frontera, will then share the impact of lack of paid sick time and what it has done to their members. Finally, Ellen Bravo, strategic advisor to the Family Values at Work Network, will talk about the administration's emergency relief package and what Wisconsinites can do to make it a reality. So, Dr. Heller, I'll call on you first.
Thanks so much, Shaniva. And good morning, everybody, and thank you for joining us. As you all know, COVID-19 continues to devastate Wisconsin and the country. The number of cases and deaths continues to rise dramatically, and an incredible number of people will have serious COVID-19 related long-term health conditions. It is amazing that the vaccines are now available, but it will take many months before everyone is vaccinated. In Wisconsin and around the country, work sites are sites of infection and outbreaks. That includes healthcare settings, but many other work sites as well, where our essential workers are still going into work, like grocery stores, schools, meatpacking plants, and warehouses. Thousands of workplace outbreaks are currently being investigated in Wisconsin. Many of these essential workers are people of color, and many are in sectors that pay low wages. The need for essential workers to leave their homes to go to work has contributed to the inequitable impact the pandemic has had. Importantly, many employers of these essential workers do not provide paid time off when workers are infected with COVID-19 or have been exposed to it. That leaves workers caught between hazards. They can either go into work and risk spreading the disease to customers and coworkers in order to earn the income they need to pay for their basic necessities, or they can stay home to isolate or quarantine, but not be able to pay their rent or their heating bill or buy food for their family. Forcing workers to make this impossible choice has resulted in a huge number of workplace outbreaks, as well as huge numbers of suffering families. The University of Wisconsin Population Health Institute analyzed the potential impact of 3 policy options that could address this issue: paid sick leave, changing workers' compensation so that if workers are exposed in the workplace and later become infected, the rebuttable presumption is that they were infected in the workplace. And third, direct payments to informal sector workers, including gig workers and undocumented workers, who would likely not have access to paid sick leave or workers' compensation when they need to isolate or quarantine. Our report summarizes publicly available data about COVID-19 and worksite transmission, the peer-reviewed and gray literature, and several interviews conducted in Wisconsin. We use this information to draw conclusions about the impact these 3 policies would have on COVID-19 spread. Here's what we found about the current context. Approximately 1 in 5 US workers are being exposed to the virus at their workplace at least once per month, and at least 1 in 10 are being exposed at least once per week. Approximately 600,000 employees in Wisconsin do not have regular access to paid sick days. The federal Families First Coronavirus Response Act provided emergency paid sick leave, but that expired on December 31st and excluded approximately 140,000 employees at large corporations and many other workers in the state. Some employers have official paid sick leave policies, but just discourage workers from using it or even discipline or fire them when they do. Workers' compensation is not being used to replace lost income for many workers who have become ill after workplace exposure to COVID-19, including many healthcare workers. Most undocumented workers and gig workers do not have a source of income if they stay home to quarantine or isolate. This income disruption has compounding impacts. For example, the inability to afford food or housing or medicine or childcare. And all of that results in numerous negative health impacts in addition to whatever people are experiencing from COVID. Current policies contribute to the increased spread of COVID-19 in Wisconsin, impacting the health and well-being of workers, families, and communities, as well as affecting businesses and the economy. We found that if paid sick leave were available to all workers, there would be a significant reduction in the spread of COVID-19 in Wisconsin, potentially by an estimated 10,000 cases each month and over 75 lives saved each month. We found that paid sick day laws elsewhere have not led to loss of wages or employment, and paid sick day requirements could allow businesses to return to normal operations more quickly, benefiting both business and employee health. We also found that many states, including Minnesota, Illinois, and Michigan, have expanded workers' compensation coverage to include a rebuttable presumption of workplace COVID-19 infection. Such changes to workers' compensation could decrease workplace transmission by allowing workers to receive income when they need to miss work to isolate. And last, we found that those 2 policies by themselves are insufficient because they leave some workers out. Access to direct payments for any worker who does not have access to paid sick leave or workers' compensation could also decrease workplace transmission and reduce community spread of COVID-19. In summary, evidence suggests that this set of policy changes would help ensure workers in Wisconsin do not have a disruption in income when they need to isolate or quarantine when they're infected with or have been exposed to COVID-19. These policies would contribute to the slowing of the spread of the virus in the state until we're all vaccinated. The health of the public and the health of the economy are intertwined. Controlling the pandemic and reopening the economy both depend on protecting workers. Thank you.
Thank you so much, Dr. Heller. So again, this is Shaniva Smith, the Wisconsin Senior Organizer for the Wisconsin chapter of 9 to 5. So paid leave and paid sick days is very crucial very crucial for all residents of Wisconsin. So 9 to 5 launched the Keep Families First Coalition to help win Wisconsin FMLA. 12 and a half years ago, 9 to 5, Voices de la Frontera and dozens of other groups organized a ballot initiative to win paid sick days in Milwaukee. Our partners included groups like Fight Asthma Milwaukee, the Black Health Coalition, the Latino Health Coalition, and many public health professionals. They knew with the pandemic in its report spotlight, our lives are interdependent. Each of us is only as healthy as the person who prepares and serves our food, drives our children's school bus, delivers our packages, cares for our loved ones with a chronic illness or disability. We won a paid sick days ballot initiative in Milwaukee decisively in November of 2008, but we faced a lawsuit from corporate lobbies. It was also overturned by the Walker administration through preemption. Eventually, we won the courts, and then conservatives in the Wisconsin legislature took away the right for cities to make decisions about their own communities when it comes to issues like paid time to care. They stole our win and put tens of thousands of Milwaukee residents in peril. Many 9 to 5 Wisconsin members remain at risk as a result. They are largely people of color and low income, mostly women. Not only do we have one of the most povertized zip codes in the nation, but we are also notorious for being known as one of the worst states to raise an African-American family. We have failed school systems, the prison to pipeline system, and a plethora of other oppressive systems that infinitely affect people of color and other marginalized groups. Wisconsin is a state where a lot of women also serve as caregivers inside and outside of their homes. They are essential workers who do the work our city depends on, but their jobs are typically undervalued because of the legacy of race and gender discrimination. For them, taking time to quarantine or isolate if they are exposed to COVID-19 means risking their pay and, for many, their jobs. It is not fair or humane to put anyone in a situation where they are given an ultimatum to choose between any essential of their livelihood. We welcome the work of the University of Wisconsin Population Health Institute. It reinforces earlier findings by a health affairs study last October that showed access to paid sick days significantly decreased the number of reported new COVID-19 cases, with 56% fewer cases occurring as a result of the last year's federal coronavirus relief legislation. This science is precisely what we need to guide public policy. Our physical and economic health depend on it. Wisconsin needed statewide paid family leave and paid sick days before the COVID-19 pandemic, and it is evident that Wisconsin will need it in the near future. And now we'll hear from Belinda Thielen, an industrial hygienist with Voices de la Frontera. Belinda, if you want to go ahead.
Thank you, Shaniva. So many of the workers who are members of Voces de la Frontera are the people who have kept us all fed and who have maintained the essential machinery of society throughout the pandemic. Not only have these workers done this at great risk to their own health and that of their families, but their risk has been treated with cold indifference. The lack of transparency about workplace exposures to COVID, inadequate protective equipment, and ineffective and unenforced safety measures have combined to make workplaces major sources of COVID exposure. But many workers simply cannot afford the loss of income that isolation or quarantine would entail. Workers who take the necessary time off from work risk disciplinary action or termination. This is why Voces de la Frontera formed the Voces Essential Workers' Rights Network in April 2020 to meet the urgent need of supporting and defending workers who were organizing and who continue to organize for adequate workplace protections. We have spoken with many workers who have worked while sick or who have made the decision not to get tested for COVID because a positive test result would jeopardize their livelihood and their ability to support their families. We organized a 6-week series of Spanish language workshops in the fall of 2020 to train undocumented workers in defending themselves, and we've had several successful settlements with them. But this is not enough. Workers across the state of Wisconsin deserve adequate paid sick leave without having to fight for it. The most basic protection, the ability to stay home without fear of reprisal or severe economic consequences, has been denied to many of these essential workers. Paid sick leave has always been an important health protection for workers. In the face of a pandemic, paid sick leave is a matter of life or death for workers, their families, and our communities. We must ensure that all workers have the right to paid sick leave. For all these reasons, Voces de la Frontera wholeheartedly welcomes and supports the University of Wisconsin Population Health Institute's Healthy Workers, Thriving Wisconsin report. Thank you.
Thanks so much, Belinda. And now our final speaker is Ellen Bravo, Strategic Advisor of the Family Values at Work Network, which we are a proud member of. Over to you, Ellen.
It's great to be here, and thanks so much for all this terrific work. It's really exciting to hear about it. Dr. Heller mentioned that last spring, Congress passed the Families First Coronavirus Response Act, and this was great. It was a huge help to a lot of people to having 2 weeks of paid sick days. But as he mentioned, it left out a lot of folks. So if you work for a company of 500 or more, if you were a healthcare worker, if you were an emergency responder, you were left out in the cold. In addition, the Families First Act had a great provision for parents whose kids were home because school or daycare was closed, up to another 10 weeks of paid family leave. But that didn't apply if your COVID lasted more than 2 weeks, which more and more we're learning is a case for lots of people. So we've heard from Shaniva and Belinda what this means for family health and economic security, and a lot of us know that up close and personal. And we heard from Dr. Heller that there's a solution, including paid sick days for everyone. And I have some good news for you. The Biden-Harris administration has introduced the American Relief Plan, and it does just that. It would finally expand the coverage so it applies to all workers, part-time and full-time, gig workers, people in every size company. It would give up to 14 weeks of paid time. It would include, in addition to caring for children who are home, if you needed that time to recover from or care for someone recovering from COVID. It's $1,400 a week. So that means for people earning up to $73,000, it would provide their full wage. And that's 3/4 of workers. That's really important. We can't tell people you can have paid leave and then have it be so little money that they can't afford to take it. It also helps small businesses, or businesses under 500 would get 100% refunded for the cost of providing this time. And that's really great as well. So we got to see this as a real opportunity, as important as the vaccine that I'm going to get this afternoon to stopping the virus. It is an essential tool in getting our country back on its feet, both in terms of health and in terms of the economy. And what we have to realize is this is a time for major investment in families, health and economic security, so that money starts flowing through communities. That's what it means to invest. And that's what we need to recover from the economic devastation of the past 10 months. So here's the thing. In addition to emergency measures, I think you all know that babies in cancer and heart attacks did not go on vacation during the pandemic. So people need permanent paid leave as well. And so that's a second piece of good news I have. Congress is about to reintroduce the Family Act next week. And that's what it would do, is provide permanent up to 12 weeks, whether you're welcoming a new child or caring for serious personal or family illness. We all want to put families first and be there for the ones that we love and follow doctor's orders. These public policies are what we need to do that. So we welcome your report, Dr. Heller. We welcome the grassroots organizing that 9 to 5 and Voces and other groups are doing. We're proud to be part of it, and Shaniva will tell you a little more about what you can do to make a difference. Thanks.
Thanks so much, Ellen. So unfortunately, our state legislature has not been open to including paid sick days in COVID relief legislation. This federal emergency bill offers a real opportunity for workers in Wisconsin. We urge Wisconsin voters to contact their congressional rep and both senators to share these findings and the urgency of action now. So just text paid leave to 844-955-2880. Again, that is 844-955-2880, and you'll find sample points and get connected to your own members of Congress. And now I'd like to open up the mic to members of the press. Please indicate in the chat if you'd like to ask a question. Sophia, I'll pass it to you.
Thank you. We do have 2 questions from Latoya Dennis, who's with the Milwaukee Public Radio. The first question is, are people who work in certain industries more likely to be impacted? And the second question is, have you spoken with any lawmakers who are willing to push this forward? For the first question, I'm wondering, Jonathan, if you might want to take a crack at that.
Yeah, absolutely. Several answers for that. Yes, we know a little bit about this. The state health department in Wisconsin was trying to release data on workplace outbreaks. There was a lawsuit that stopped that, so we don't have a lot of detailed information, but they have released some information, and there's a lot of national information. The report includes a figure that shows transmission risks by industry. At the top are accommodation and food service workers, retail trade, manufacturing, and healthcare work sites. Educational services are next. In addition, there's a new report that I think came out this morning that takes data from California that shows increased risk in certain occupations. At the top are similarly food or agricultural workers, transportation or logistic workers, and facility workers as well. And I can drop the link to that new report into the chat as well.
Thank you, Jonathan. The second question was, have you spoken with any lawmakers who are willing to push this forward?
So I can just say that since this is federal, we know that Representative Gwen Moore and Ron Kind and Senator Tammy Baldwin have been long proponents, both of the permanent policy in the Family Act, they're all sponsors of it and will be again, and of the what was called the HEROES Act, which was an attempt that it passed in the House and the Senate refused to take it up. And it would have done what this emergency American Rescue Plan does, of expanding the paid time to all workers and making it cover the reason of recovering from COVID as well. So we expect their support. And as you can see, this call to action is to encourage all the other members of Congress to do the same, and senators to do the same.
Thanks, Ellen. Do we have any other questions? Okay. Well, I want to be respectful of folks' time. I want to thank you everyone for joining us. I will be sending out the statements that were delivered today, as well as a press release from the University of Wisconsin. You'll be getting that shortly after the press event ends. And if you have any questions or are interested in doing any interviews, please feel free to respond to that email and I'll be happy to facilitate. Once again, I thank you all for joining us and I hope you have a wonderful Wednesday.
Thank you.